I think one of the things that I'd like to drive home with you is that the civil rights issue for the Asian American Pacific Islander community is none other than data disaggregation.
Sure. Yeah, that makes total sense.
So, and it's maybe not as sexy or kind of something that may like truly galvanize someone on the street, but unless we break down these communities, because I think right now, I mean, there was a long time where in certain counties, if you were Asian American, you had to check the box other. So unless you're going to know about and truly understand these communities, so data disaggregation and doing that inside government agencies as well as across the board in corporations is so critically important.
Lift yourself up on your feet. Let's get it on. Lift yourself up on your feet. Let's get it on. Lift yourself up on your feet. Let's get it on.
So my name is Dorina Wong. I am the director of our Health Access Project at Asian Americans Advancing Justice, Los Angeles. I always had the intention when I went to law school to do public interest work, social change work. So I've always worked in public interest organizations, right, for many years now. It's for over 30 years. So it's been a long kind of pathway. But along the way, actually one of my earliest positions was at the Asian Law Caucus, which is one of the affiliates for Asian Americans Advancing Justice in San Francisco. I came and was working with the National Health Law Program, which is a support center or backup center for legal services, at least it was, on healthcare issues, especially on publicly funded programs like Medicaid, CHIP, other programs for low-income individuals to get some health coverage. The Asian American, Native Hawaiian, and Pacific Islander community is really very diverse. And so what happens oftentimes is we're kind of all thrown in there as like one community. I mean, finally they have, like the census have finally divided Asians from Pacific Islanders, but for many years, Pacific Islanders was subsumed into in API, right, the Asian and Pacific Islander communities. They were completely invisible or overlooked. So that continues to happen, right, because we have so many different populations that health affects them very differently. There's different rates of uninsurance in the community, like Koreans and Vietnamese always have had higher uninsured rates. There's different chronic conditions that impact our community. There's, let's say the Pacific Islander community suffers from like higher rates of diabetes, but when you throw everybody into this category of Asian, Asian Pacific Islander, then on average, the ones that suffer more and the ones that do better, they get it's an average, right? It doesn't really identify the true nature or what's really happening within those subpopulations, right? So on average, perhaps, we're doing better than some other racial groups, but when you look and dive deeper and look into those subpopulations, you'll notice that there's certain, like Vietnamese women have a higher rate of, or lower rate, let's say, of cervical screenings, and so, may have higher rates of cervical cancer, things like that. So you can't just look at us as one whole population and assume that we're all doing fine, because there's some in especially the smaller Asian populations, the subgroups within, like the smaller Asian ethnic groups within the larger rubric of Asian Pacific Islander, that are suffering more health disparities than others. Our needs are unique and different, just like every kind of community has its own challenges and needs, whether it's African American, Latino, the LGBTQ community, people with disabilities. But a lot of times it's the same idea, like when I was talking before about all the different subgroups subsumed into the category of Asian American, Native Hawaiian, Pacific Islanders, all the separate needs within each group gets lost. And that's true for whether you're Asian Pacific Islander or Latino or African American or whatever group you're in. You always have certain, because there's health disparities, there's discrimination, people are treated, differently, and people just come from different cultures and they have different levels of knowledge. So you need kind of a targeted approach, especially around education, to bring people along. And then you need targeted solutions for those groups. So for our community, we, as I said before, at best we're kind of an afterthought or completely ignored, because our community is so diverse. We have a lot of needs. We have a lot of language, cultural and linguistic needs. And you know that oftentimes you might get like materials translated into Spanish, but hardly ever do you get them translated into the multitude of Asian and Pacific Islander languages. And so that's what we do. We actually have to translate many, many materials in different languages, right? But the state doesn't, they do what they are required to do, but it's not enough to serve our communities. They just don't provide the level of cultural and linguistic accessible materials or appropriate materials or education or outreach that is needed within our communities. And also to even provide like the in-language assistance, like interpreter services. Like when you go to a doctor, it's a no-brainer that if you can't communicate with your doctor, then you're gonna have problems, right? But so many times we hear that when people go to their doctor, they don't have an interpreter there and they don't have anybody to speak their language. Now, how in the world can they explain what's going on, right? So that one would think is, again, obvious that you have to be able to communicate, but we still hear of problems with people going to see their doctor, their provider, and not having, somebody, an interpreter there or somebody that speaks their language, right? But, and actually the irony of this is that it is legally required, for people to provide interpreters, but not even providers know that, and not even our community knows that. We believe that everybody in this country, that healthcare is a right. Everybody in this country should have access to not only health coverage, but actual services. And not only just any kind of services, but culturally and linguistically competent services and high quality services. Well, so Asian Americans Advancing Justice Los Angeles basically is, as you say, we address many things. We're the largest legal services civil rights groups, in the country. We're part of 5 affiliates. We used to be Asian Pacific American Legal Center. So each affiliate has its own kind of independent organization, but we've come together under the affiliation of Asian Americans Advancing Justice to create kind of a more national voice for our communities, for the Asian American, Native Hawaiian, Pacific Islander communities. So we're in LA, the Asian Law Caucus is in San Francisco, there's one in Chicago, there's one in Atlanta, and one in DC, Asian American Justice Center. So, we all work on different issues, but we do come together on common issues like immigration reform, say, or citizenship work or voter engagement. But specifically here, the Los Angeles affiliate is the only one that works so much on health. We work on a lot of different issues, immigration, we have direct services on domestic violence issues, education, immigration reform, immigration and services, direct services as well. But at our affiliate here, we've created the Health Access Project, which is different than the other affiliates. And so just to give you some background about our Health Access Project, since you've asked how it's connected, right? It was our executive director, Stuart Quo, I think after the passage of the Patient Protection and Affordable Care Act, the ACA, or Obamacare, more people know it as, in 2010, I think he recognized the kind of the opportunity and the challenges for our communities, because we always face kind of discrimination, and we're always, at best, we're kind of an afterthought, or at worst, sometimes we're ignored. And so he realized that after healthcare reform, there was a chance to expand coverage and access to our communities, but we had to be affirmative about that. We had to have a strategy around that. So then he wanted to create this Health Access Project in order to ensure that our communities would be able to gain coverage under these new programs. It was a great opportunity, right? And so he kind of knew that I had been working on healthcare issues at the National Health Law Program, and I had been working with Asian Americans Advancing Justice LA for many years on language, like cultural and linguistic competency issues, right? Cultural and linguistic access issues, especially around language access issues with people here. So I've been working with the organization kind of indirectly, not on staff, but since I was at the National Health Law Program. I was there for 11 years. So, it was a natural fit, I guess, when they asked me to come here to kind of help start the Health Access Project. So our Health Justice Network, as I was explaining, is a collaborative of about 60 different community-based agencies and community clinics. So, and a lot of them are smaller CBOs. And so we try to provide them support, help them build their capacity, and provide trainings and technical assistance to them. We have regular communications through monthly calls, and we have convenings where we bring everybody together. And to try to keep people up to date, because they're doing the on-the-ground work like we are, but they're doing it specifically for their communities, for their specific, whether it's Chinese or Thai or South Asian communities, they sometimes need updates about the changes in the programs, upcoming issues that are going to be impacting our community, all this back and forth about healthcare reform. And there's constantly lots of different bills and, as I say, proposed changes, right, to usually improve the system, but not always. So we also work with the Department of Healthcare Services, because we also work in enrolling people into the Medi-Cal, which is for low-income folks, which is free or low-cost coverage for people that make less than about $17,000 a year. So we also enroll people in that program, and we're also trying to make sure that that program, again, is responsive to our communities, because unless you're at the table, they won't, that's the only time you can raise problems, right? Well, it's kind of hard to know. We're fighting on so many fronts against, what Trump and his administration is doing. So kind of our organizational mantra has been, and this is across all areas, because we're being attacked across all areas, where there's not just health, it's not just immigration, it's education, it's any kind of, across all issues, right? They're trying to pull back all the gains that we've made. So our kind of organizational mantra is like protect, resist, and advance, right? So protect the gains that we have, right? That we've made a lot of gains, but you can never, you become complacent, and you always have to be vigilant, and protect and make sure that you protect what we've been able, the differences and the gains that we've made. And then you have to resist, right? We have to resist all the rollbacks that the administration is doing, and Congress too. It's not just Trump, it's Congress too. And then advance in places where we can advance. So in California, we are lucky because we're in a blue state, we're in a progressive state. We're not, our state is also not pulling back like in some of the conservative states. We are actually like having a discussion around how can we make, how can we move towards universal care. So hopefully it'll generate interest, generate actions, and people will actually, try to go out and kind of change change the, or at least support people or support representatives that represent their interests.